Hello, everyone, and a very warm welcome to today's webinar on Unlocking Global Horizons, Navigating Europe through the Erasmus Mundus Journey. I'm Dr. Kaushik Mujumdar from Chittagong Medical College, and it's my pleasure to be with you all on behalf of Chittagong Medical College Research Club. We are delighted to host this session, which we hope will be both inspiring and informative for those aspiring to pursue careers and higher studies in the evolving field of public health. CMCRC is a student-led platform dedicated to foster a culture of research among medical students and young doctors. We aim to nurture critical thinking, provide guidance on research methodology, and create opportunities to engage with national and international experts in the diverse field of health and medicine. We are honored to welcome our keynote speaker, Dr. Irfanul Alam, a proud CMC alumnus, currently serving as a specialty doctor in occupational health medicine at UHCW NHS Trust, UK. He's also a former WHO consultant and an Erasmus Mundus scholar. We are equally delighted to have with us Mr. Varun Kumar, President of the Europub Health Students and Alumni Association and an Erasmus scholar with extensive experience in global health and public health research. On behalf of the CMCRC, I would like to extend our heartfelt thanks to our esteemed speakers for joining us today. We are truly honored to have you with us, and I'm confident that your journeys and insights will inspire many of us. I also thank all the participants for being here. Now let's get started with our first speaker, Mr. Varun Kumar, President of EPHSA and Erasmus Plus Scholar. We are really excited to hear your story and insights. Over to you, Mr. Kumar.
Course. Thanks for the warm introduction, Kaushik. I'm truly honored. And I'll just quickly go through a presentation to introduce the program very briefly. I will not go into the details of it because I think that you can find online as well. But I would also touch upon what EFSA is, for which I'm the president right now. And then if there are any questions, then we can take them up as well. So I am sharing my screen. So you can let me know whenever it is visible. Can you see my screen?
Yeah, we can see your screen.
Yes. Of course. Okay. So first of all, I think thank you for joining everyone. Um, I will mostly be touching upon two subjects. One is about what the program is, which is European Public Health plus Masters, and then about EFSA, which is a student and alumni association that we have tagged to the program. Uh, and I mean, more details are to follow in the next slides. So let's move on with it. In in very brief, I think if I talk about the program, then it is an Erasmus Mundus joint masters. I hope you have heard of Erasmus Mundus, but then Erasmus Mundus is, just to tell you, it is one of the main sources of scholarships in Europe, and it is quite popular in this part of the world. And it is considered a very prestigious fact if a person is an Erasmus scholar. And this program, the Europe of Health Plus Masters, is conducted by a co-funding that comes from Erasmus Mundus and Erasmus, obviously. And in this particular program, you interact with like 8 different universities because it is a consortium of these 8 universities based in 8 different countries. And a person is able to choose their specialty and the subjects they want to study, and accordingly choose the country they want to do. Um, I mean, as a part of any Erasmus program, not just Europe of Health, you are allowed to study in 3 different countries, and that gives you that international exposure. And at the same time, you are also getting exposed to a lot of other people who are coming from many different nationalities. And that is why it is sort of like a very international sort of an experience, and you get immersed in so many different cultures at the same time while learning the language of the country that you're going to. In the United Kingdom, I visited Belgium, the institutes being UCD, University of Liège, University of Sheffield, and University of Granada, based on what language they can prefer and then what subjects they want to study. And then it is followed with a 3 weeks immersion module, which happens in Rennes. Rennes is a city in France. And out here, with people coming from like both years, because it is a 2 year long program. So at the end of each year, people just come over to Rennes, meet together, and there are some credits that you're supposed to gather again. And after that, they go back to their year twos. And in year two, the options are again Spain, France, uh, Krakow, which is in Poland, and Netherlands. And again, there are different specialities that you can see on the screen right now, and you can also find online. And people can choose between that. And it again culminates in an integration module followed with graduation and everything. So that's in brief how the program works. In total, this accounts for 120 CTS, and that is why that particular person, is then eligible to get two different masters. It is not just one master's, but two different masters that you get upon graduation. And in this, if I talk about the different things that you get through the program, the awarded documents are a Europub Health Certificate of Achievement, a joint diploma, which comes from Europub Health, and then your master's degrees from year two as well as year one institutions. Um, Unlike any other programs, like the way you would do like two different masters, then you're supposed to work on two different theses, versus here, because the first institution honors the fact that the second institution is at par and hence honors the dissertation that you submit in the second institution. You just work on basically just one project at the end of your degree, which is mostly like 4 to 6 years, 4 to 6 months long. It is again a very multicultural experience. Just to show you the present situation. So this is 2025-26. We have 73 students in the program, including me, and this is the spread of where we come from. So presently, these 73 students are coming from 36 nationalities. A surprising fact, we are quite North America heavy this time, but then you can at the same time see that people are from all different parts of the world. You can see Australia, you can see Russia, South America, India, and a lot of countries in Europe as well. And it just changes every year. This is this present situation, but then yeah, I want to just convey that it is a very multicultural sort of an experience, and then you get exposed to many different nationalities. And of course, this is one sort of a development that you get in addition to what you're studying. Talking about EFSA now. So Varun, this year, I am the president for EFSA. And EFSA is a student and alumni association that is dedicated to this particular program that we are talking about. And in this, we have presently 312 members, and this includes the current students, some incoming students, and also alumni from the program. And that is why, um, I mean, we are having this conversation because we are a network of alumnus from, I mean, whoever has graduated from the program, and we are mostly connected. And through the network, we then come together, collaborate on the various things, and it is a very harmonious sort of a community that is maintained all through. So the agency is EFSA is registered in France, and the mission, if I just read it out to you, is to facilitate, strengthen, and protect personal and professional relationships among alumni, current and incoming students, and partner institutions of EPH Plus program. When I say partner institutions, it is those 8 universities that we just talked about. Um, Not again getting into the details, but then in as our objectives, we try to create a place where people can share their career experiences, also opportunities, there are also platforms where we discuss other issues. So, for example, very recently we conducted a webinar for the people who are joining us in the program this year. And then in January, or maybe it'll be late December or early January, we are going to conduct another webinar, which will be for people who are aspiring to be a part of this program, which can be interesting for you guys, because if you're planning to apply for this program in the coming year, then you can maybe join that webinar and get more information. And there are also opportunities of collaborating with various agencies, because there are many activities that happen through the year. And we are also representing the degree at the consortium, as well as the Erasmus Mundus body, which is broader, which includes like many different programs apart from EPH Plus. Presently on the board, I, Varun Kumar, I'm the president. I'm from India, and I have other members on the board as well. They're not present for this meeting, but then we all work together. Other student and alumni representatives who are a part of the board as cohort representatives or MR representatives, or even a new agency which is coming up, which is the Alumni Advisory Board that we have just announced yesterday. So that's like the structure right now, and the activities that we support the program, and beyond the incoming students who are for the program, are in terms of organizing an EPH plus mentorship program, which is for current students. And through that, we connect the students to uh, alumni of the program and even other professionals who are there in the industry. For example, last year, Dr. Alam, who was a part of this meeting, was one of our mentors in the program. And because I was in my year one, I was one of the mentees. And one of my classmates was, in fact, tagged to Dr. Alam at that point, like the way we were discussing just a couple of minutes back. We also have something called EFSA Talks, and these are webinars that are hosted. From this year on, we are planning to host these webinars for everyone. I mean, there's going to be public access. And on top of it, we also have a YouTube channel where we post these videos. And these are very enriching discussions that we've had in the last year, or even the years before that. And you can always access that. And I think you can gather a lot of insights from these professionals who are working in the industry, and especially people who are working in this part of the world, as to how programs function in a different way than what we see in developing countries, or rather the global south. Also, there's also a feedback collection that goes on the entire year, and we disseminate a lot of these feedback that come from incoming students as well as the existing students, and we share it with the consortium partners and also the universities if a cohort representative is there itself. And we also help in organizing some of the events for alumnus as well as students. And that's about it. But keeping it brief, thank you for listening. I'll just stop here. If you have any questions, then please keep it coming. Or we can also maybe take it up later on, depending on how the meeting works. Maybe. So, Kaushik, are you still there?
Yeah, I'm still here.
Can you see it?
Thank you, Varun, for the wonderful presentation. Uh, like, you want to take the questions right now, as you have some other commitments from, like it's only 33 minutes left. So you want to take the questions right now?
Of course, of course. I'm fine with it. We can do the way you want. Sure.
Okay, participants. If any one of you have like has any questions, you can raise your hand, unmute yourself, or even you can ask the questions in the chat box.
In the meantime, I think like I can also mention that I mean, I did not talk about my background. So I am a biomedical scientist by my bachelor's. And after that, I also did a health management master's. So I had an MBA and I worked for 8 years in public health before joining the program. So, I mean, I'm keen to share that because it is always advised that you always see what is there in this industry, always experience things, and then commit yourself to it, because for some people it can be really frustrating. And it is a lot of cost burden as well if you live in a different country, if you make this choice of moving to a different country, a different place. There are a lot of adjustments that you're supposed to take up. So, I mean, it requires that commitment, it requires that enthusiasm to do it. And I would always advise that you should first see whether public health is for you or not, and then make your call. So that way, I think it also betters your chance of getting selected to the program because it is a very competitive degree, considering that there are like thousands of applicants and there are basically just about 40 seats that are there. So yeah, I would always send that advice to anybody who's talking to me about this program that you should first see whether this is for you or not, and then decide for it. So, do we have any questions?
I yeah, we got a question in the chat box. How to join Euro Public Health programs? Is this a postgraduate program?
Right. So, as I talked about it, yes, it is a master's degree. In fact, a dual master's degree, wherein in the first year you do an MPH, and in the second year you do MPH is Masters of Public Health, and then in the second year you do a specialization depending upon your choice. Specializations can be like epidemiology and biostatistics, what I'm doing right now. It can also be in health promotion. It can be in health service management, and leadership and management. There are multiple specializations that are available. You can look up the website and you'll be able to find out. There is also more information. I'm happy to put the link out here in chat if that helps. And the application cycle for the program is, um, I think it opens in about another 2 months. So you can be on the lookout and you can be checking the website. And I think around November or December, you might start getting that notification that the applications have opened and everything. And you're supposed to make your profile, you're supposed to submit it. And then the process is that they look at that and then shortlist you for some interviews at times. And as a part of your application, you already have your essays and everything submitted. So you justify that in your interview, and then they decide whether you can be given a scholarship or not, or otherwise can it be offered even without scholarship. Even if you do not get a scholarship, I must tell you that it is quite subsidized as compared to doing a master's in Europe. And even as a self-funded student, your fees is maybe just about 20% of what you would pay otherwise. And the main burden is generally of the living expenditure for which you can see whether you have funds or not. We can then decide. So, I mean, that's the process, and more information is there on the website. I'm happy to post it here.
There's another question from a dentist in Brazil. The question is,
Mhm.
do you think she's a probably, yeah, sorry, he or she, I'm not getting it, but like the person is saying that she is a dentist in Brazil, and do you think I can join the program?
Oh, I would love to answer that, but I think Dr. Alam wants to come in, and I would hand it over to him.
Yeah, just for this person, Ariani and Jose, I'm from 2018-20 cohort of the program Europe of Health. We had a very good friend, Renan. He was a dentist and he was also from Brazil. He came with scholarship and he completed his double masters and from I think from Sheffield and then Krakow. He did his program and yes, because public health is a bridging program. Public health is a bridging subject. It's not meant only for the doctors or nurses or even we had a lawyer, engineer, and different professionals. They do this program. They participate in this program, and you can always join the program. You are eligible to join that if you are a dentist or yeah. I will discuss this more in my presentation. Thank you.
Sure. I mean, just as a very generic answer, because I was checking the chat and I can see that people are asking what one has to do in this area, what after achieving this degree. So I think just in brief, if I can touch upon that, then I think it will be dealt with in detail by Dr. Alam later on. But then just to add there, I think public health is a discipline which is in addition to your medical science. So, on one hand, are the people who are delivering care, who are curing patients, and it is very individualistic. Versus, you require somebody to just think what is to be done for people. It is not just at that individual level, but for masses. How do I make sure that healthcare is provided to everyone? How do I make sure that if I'm preventing diseases, then it is happening in the right way, and my population is getting that immunity. You have must have heard of components like herd immunity, right? So those things are talked about. Those things are researched by public health researchers like Dr. Alam and me. And we contribute a lot of this knowledge and also help in managing the show beyond what a medical doctor does. So it is, I would say, a parallel pillar to your medical science, and it is not individualistic. It is rather for the broader population, the population at large. I hope that makes sense, but I'm sure Dr. Alam will be doing much more justice to it. Any other questions?
There are some questions in the chat box. I believe Dr. Irfanul Alam will cover those questions during his presentation. Or
Yeah, I think just on the publication thing, yes, it
yeah,
helps if you have a publication. So always appreciate it, because I think if you are planning to move to the Western world, then out here, it always is given a lot of emphasis if you're scientifically sound. So if you have any publications, then it's always a good way to go. Um, Okay, I think rest of it is parked for the next presentation, and we can move ahead, I think.
okay. Thank you, Varun, for the presentation. Now I'd like to move to Dr. Irfanul Alam's presentation.
Thank you so much.
Can you see my window?
Yes, you can.
Yeah,
So is it the slideshow taking place, or you are watching my main window? I'm not sure. Just a minute. Give me a minute while I
Are we able to see
start
your
presenting.
slideshow, Dr.
Sorry, can you please answer that again?
I
we are
was
seeing
saying we were
your
able to see that
presentation
previously,
slides.
but now you're,
Now
yeah.
I think you can see the slideshow. All right.
Yeah, it's fine now.
Okay. So first, my background, as many of you know, that I'm from Chittagong Medical College. I'm 46th MBBS. I graduated in 2010. And my specialization is environmental and occupational health. And also now I'm doing a further specialization in occupational medicine, as I'm working as a specialty doctor in occupational health medicine in Coventry and Warwickshire NHS Foundation Trust. Also, I'm affiliated with Society of Occupational Medicine in the UK and the Royal Society of Public Health. I did my double masters from Sheffield and Paris. With Sheffield was the foundation year, and Paris was the uh, in Paris I did my specialization in environmental and occupational health. And currently I'm doing a further specialization in healthy working lives group, which is a School of Health and Wellbeing under the University of Glasgow. Previously, I worked for World Health Organization. I worked in different level. I worked for the WHO headquarters in Geneva during the first wave of COVID-19 pandemic, and then I worked in Cox's Bazar for more than 3 years as in my capacity as an environmental and occupational health specialist. Prior to that, prior to joining this Erasmus Mundus EPH master's program. I was actually doing my post graduation in radiology. So I think I should tell you this story for a bit context. So I passed the FCPS radiology part one, which is a very some of you might know that it's very competitive exam because you have to sit for a paper for on radiation physics. So radiation physics is not easy for us. Um, since after doing our college, we don't study physics. Who come to the medical field. Um, so I cleared that. Then I was fortunate to receive this scholarship, and then I joined this. And even prior to that, my career started with in an Australian oil and gas concern named Santos. And later I worked in the Sangu operations, which is in Fozdarhat. That was on I think single offshore platform, offshore oil and gas platform in Bangladesh. We had a plant in Salimpur in Fozdarhat, and also an offshore platform in the shallow blocks of the Bay of Bengal, where we operated. So I used to work there as an um, occupational health physician, but I finished that project as the head of the environment, health, and safety because that gas reserve was declining over the years. And later, I joined GlaxoSmithKline as their occupational health manager, as the capacity of occupational health physician. So some of my leadership attributes, currently I'm working as a principal doctor for the Department of Occupational Health in UHCW. I'm a former, I'm not sure, Varun can answer this. Previously, there was in the EFSA organization, there was two president, like one is from the alumni and one is from the student side. So I was from the student side, and it was the title was co-president. I was elected representative for Europe of Health cohort in University of Sheffield. During my graduation years in Chittagong Medical College, I was also involved in many voluntary organizations. Volunteering is the core of my journey that started from Chittagong Medical College, Shondhani, and that led me to different places. I attended International Federation of Medical Student Associations, their General Assembly in Jakarta, as a Central Executive Member of Bangladesh Medical Students Society, and so on. So let's go to the slide. There are some photos from my journey so far. The first one, I was uh, inaugurating this conference for Shondhani Chittagong Medical College unit. You might be a bit confused to see me in coverall, but that is the normal working uniform for oil and gas. This in Sheffield. I was working in Geneva. I worked in Cox's Bazar in different capacities. So that's my journey from I just became a doctor like many of you. I came doing internship in Chittagong Medical College in the surgery department. I was assisting one of the surgeon in a surgery. Some other photos, and this is a very highlight of my career, working under direct supervision of Dr. Tedros and his team and Dr. Mike Ryan. So without doing much ado, let's start the first part of my presentation. My presentation is quite long, but I hope you will have the concentration to stick with till the end. So since I know that many of you are medical students who are in the medical college doing your MBBS, maybe in first year, second year to fifth year, or in your BDS program. So there are difference in roles in the healthcare. So there are people who do directly involved in the healthcare as a clinician, doing some people are like a research physician doing clinical research. There are things which is a semi-clinical. So these are like people who like me. I work in a semi-clinical field, occupational health or occupational medicine specialist. They see patient at the same time they work in the policy making. They do different workplace assessment, and they also do lots of health promotion activities within the organization and in the communities. And also there is a completely non-clinical policy making and public health sphere. I will discuss more about this in this presentation. So range of academic or career background in public health, which I was discussing with Varun and in one of the participants' question. So different background comes together in this bridging subject, a bridging platform called public health, from medicine, nursery, dentistry, nursing, dentistry, nutrition, biological science or biomedical science. Varun is a biomedical scientist, as he was telling. Even agriculture, engineering, psychology, law, social work. It's really diverse. So in a health career, I believe these are the challenges what we face when we are I can say that I'm in middle of my career, not in the top, I'm in the middle, I would say. So these are the challenges we face in different phases of our career. So when we are a junior doctor, we might feel some crisis for professional identity, since we are not doing any specialization. But when we as we grow, we find challenges in our work life balance, time management, and with doing much studying and not involved in physical activities. At one stage, we always most of us find this challenging in biomedical health management. Mental and psychological health is a big issue, and honesty and reflection. I'm not going much detail into that, but this covers the ethical sphere, and there are lots of ethical issues in the healthcare practice in low and middle income countries like Bangladesh, India, and so on. So I will go to public health career pathways, which I'm entitled to talk about, not about the other things. So these are the public health career pathways generally you will find in different capacities. There are bioinformatics, there are community medicine, epidemiology, environmental health, global health, health policy and management. People who do like a health promotion. You can think about the EPI program in Bangladesh. So once upon a time, when people were scared of getting their uh, child vaccinated, but we came a long way as a nation. Now we had a successful COVID-19 vaccination, because people are not afraid of vaccination anymore. People are not afraid of needle sticks. So their health promotion and communication works. Maternal and child health is a big issue for a developing country like us. There are minority health and health disparities. So don't confuse this minority with ethnic or religious minorities. This minority can be different from different characteristics. And one example that I can give you, during the COVID, after at the end of the COVID-19 pandemic, we saw that there are people who were who suffered most during the COVID-19 pandemic, apart from the elderlies and who had chronic diseases. Those are in UK, there are studies that says that people are from Black, then Asian, and other ethnic minorities. They suffered more. There were more difficult access for them in the healthcare. So there are lots of issues. So in those places, these public health specialists work. There are social and behavioral aspect of health. So many of you already read about community medicine, and you had to in our education context, you had to memorize the definition of health, which is very annoying. So there are different aspects of health: social, behavioral, spiritual, not merely it's a physical or mental health. So there are different aspects. So there are public health specialists who work on social and behavioral health as well. So these are the specializations. If we bring them into broader headings, there are biostatistics and bioinformatics specialists, like biostatician, medical and health services manager, health informatics specialist, data analyst, and research assistant, whose work is mostly data driven. And now it's a big time for AI in health. So these people are now rolling out the biggest shows all over in the health arena, apart from the clinicians, I would say. Epidemiology is there, epidemiologist, field investigator, research analyst there, and the specialty I work on, environmental health, it has also different subspecialties. We can say there are people who are environmental scientists, some are quality investigator, there are engineer who do their specialization in environmental engineering and work in public health as environmental health specialist. There are water sanitation and hygiene coordinator, occupational health coordinator, officer or manager. They all like within this fraternity, environment health and safety coordinator or manager. In terms of global health, we have a refugee coordinator, HIV or AIDS program officer, project manager, and humanitarian assistant. They work mostly in the humanitarian crisis. Health policy and management, they work mostly with the governments and with the big agencies on how health policy can be implemented, can be designed, implemented, and if needed, modified. There are people who work on health promotion, health education, and public relations. So, as I was saying, maternal and child health, it has immunization, one of the big chunk of work. Medical and health services manager for like maternal and child health services. Then women, infant, and children nutrition specialist, surveillance officer, and then minority health and health disparities. There are people who work on different aspect of this, like health equity analyst, inclusion or gender officer, social and behavioral aspect of the health. Here, there are social workers, support group coordinators, sociologists, behavioral or mental health specialists. So there are crossover between different career pathways when we talk about these specific positions, data analyst, research assistant. They have to do like they have to juggle between different roles. Some of our have a specialization in epidemiology, but he's a manager now. So he has to see how the epidemiological data interpretation makes an informed decision making while he's a manager. There are public health consultants, there are policy advisors, even different health projects. There are proposal writers, there are volunteer coordinator, public health doctors who also does some a percentage of clinical work as a part of their job role. And there are also this program coordinator, analyst, and all these positions. So this is one thing some of you might be interested about, like clinical research career pathways, like clinical research coordinator, trial manager, principal investigator, regulatory affairs specialist, and clinical data manager. I would say that these also comes under this crossover thing. Then I put a specific slide on my specialty. I'm sorry, because this is a chance to inform the future health leaders about what is occupational health and occupational medicine career pathways. And I put this specifically because this week particularly is the Society of Occupational Medicine UK's Occupational Health Awareness Week. So these people work in the industries, in the hospitals, because there are lots of hazards and risks associated with in different industries where there are people who mitigate this risk through the hierarchy of control. They can eliminate the risk, they can substitute it with a safer alternative, or they can do engineering control to separate this hazardous thing from the worker or the user. And also they can do administrative thing. One example can be in a pharmaceutical factory where people are exposed to different pharmaceutical ingredients. So people moving people into administrative control, like working in shift, will decrease their exposure to this hazardous thing where prolonged exposure can do different health impact on them. And then there are PPE, which you know that a mask, respirator, gloves, and all the things. So there are people who work on ergonomist, because a huge chunk of our working population has lower back pain and different musculoskeletal pain. Ergonomist fit your work to your job, not fit you to your job. So they make your work more contextualized to your health and your physical and mental health condition. So I will go now to the session two. Am I going too fast?
No, no, I guess it's fine.
Okay, the pace is okay, right?
Yeah.
Because I would be more interested to deliver this in a like a face-to-face or in-person session in Chittagong Medical College in one of the auditorium, but looks like I'm not going to get a chance to do that in recent future. So let's do this online. Uh, and this unlocking global horizon. Um, so I analyzed this Erasmus Mundus joint master's degrees, their catalog, and found out these programs which suits the aspiration of medical graduates from Bangladesh. So I hope you will have some takeaway from this. So why consider Erasmus Mundus? That is one of my first question. So this scholarship provides comprehensive financial support. It offers full tuition waivers, monthly stipend, and then travel grant and insurance to remove financial barrier from countries like Bangladesh, because paying for the whole tuition fees and the living expenses is a quite big chunk of money. I can remember when I was offered this scholarship, the total fund was 46,000 euros. That covers all these things, the tuition fees and the monthly stipend and everything, and travel grant event, because you have to travel far from your home country to your first year institution. So it's a pan-European study experience. So I can tell you that I studied in Sheffield, and then I traveled to different parts in the of the UK in that time. Then I moved to Paris. We did our integration module in Rennes. Also, we did like different cultural aspect of France and Europe. And then I did my internship in the WHO headquarters in Geneva, where also that was a very diverse expertise of different streams of public health were there. Accessibility and diversity. So if even if you don't get this scholarship, if there are partial fee waivers and national grants that make the program accessible to diverse global student cohort. It's a big role in your career transformation and collaboration. I would say that whoever I am, wherever I am now, there's this Erasmus Mundus scholarship, and the Europe of Health has a big role for this. So what makes this uh, I'm having some issues. Okay. What makes this Europe of Health program unique? Varun covered some of this. So the program is structured as you know that there is a 2-year joint master's program across 8 elite European universities offering interdisciplinary education. So diverse specializations, as you have already seen, biostatistics, health promotion, health governance and leadership, then and occupational, environmental and occupational health, and also I have seen one specialty that is I think added recently, that is health, environmental health in the context of climate change, and also like other specialties you can pursue. There's a personalized learning journey. Students customize their academic track, aligning to your prior experience and aspiration for a meaningful educational experience. So these are the universities that who are in the consortium for Europe of Health. Um, so there are University College Dublin, EHESP, School of Public Health in France, which is one of the grandest school of public health in France. University of Granada, Liège, then Maastricht University, Jagiellonian University Medical College, which is a like I think more than 200 years old. That university, one of the oldest university in the whole Europe. University of Sheffield, that is one of the global top 100 university. University of Bordeaux is there in France. So it's a 2-year program. The first year covers the foundational public health courses in one partner university. So year two offers a specialization in the other one, as you already know. There is one integration module in EHESP in Rennes, where you stay for 15 days and you do daily brainstorming with your peers. And solve issues in terms of global public health crisis. So there are internship and thesis for hands-on experience and research development. So the specializations. Sorry, I'm having issues with my screen, so that's why I have to move my uh, laptop. The camera is there. So there are specializations that include health services management, biostatistics, and as we said, health and environment. I believe e- environmental and occupational health is now changed to health and environment. Varun can correct me if I'm wrong. Governance, leadership, and data science. So
Okay.
eligibility
Okay.
criteria.
Environmental and Occupational Science now, UHS.
It, is it still there or they
Environment
changed it?
and yeah, it is called Environmental and Occupational Science, UHS.
Okay. EOHS, yes,
Yeah.
we did the same. I thought, is there any change in the curriculum or because when we studied, there were very few occupational health modules were there. That was
Where
one of my feedback to the consortium. So you must hold a bachelor degree in medicine, public health, life science, or related fields to qualify. English proficiency is required. The scholarship coverage is there for on average 15 to 20 students per year. And selection process, it has deadlines at the end of the early year in January, then shortlisting by merit and motivation. You have to submit a motivation letter or SOP and your CV in Europa CV format. So the next program I would like to discuss about is IDOH, which is Infectious Diseases and One Health. Um, so it has three collaborative partner institutions. One is in France, Université de Tours, and then Universitat Autónoma de Barcelona in Spain, and Hanover Medical School in Germany. It has a focus on infectious disease, immunology, and epidemiology at the university in France in the first semester. So in this program, you have to travel in like move your location in every semester. First semester you are in France, second semester you're in Spain, and semester 3 and 4 are advanced module including ethics, genomic editing, and public health in Germany, followed by internship or thesis. For this also you did a bachelor degree. English proficiency is a must, and um, the selection process includes academic transcripts, CV, motivational letter, and references. There's an online entrance test. If you're shortlisted, you have to, I think, you have to attend for an online entrance test, 60-minute multiple choice questions. I had aspiration to apply for this, but I didn't apply because I actually withdrawn my application because I was already got my selection letter from EPH, and I didn't want to. Basically, I was too lazy and I didn't want to prepare for another test. That's why I withdrawn, to be honest. Um, and this evaluation is based on academic excellence, professional experience, and motivation, and are you fit for the program? Those are evaluated. So the next program is Erasmus, which is the European Master in Neuroscience. It is delivered through multiple international universities collaborating across Europe and Canada. So here, University of Bordeaux, then this I cannot pronounce this name. This Amsterdam University in Netherlands and University of Göttingen in Germany, Berlin. Then there's a university in Portugal called University of Coimbra. Then University Laval in Canada, and in Ireland there's Galway, National University of Ireland, Galway. So these are the collaborating partners, and it's a 2-year program structure. First year covers fundamental neuroscience topic, while year two focuses on specialization and research thesis completion. So student mobility experience, student rotate across partner universities, engage in lab rotation and internship for the hands-on learning. So specializations include molecular, cellular, and physiological and cognitive neuroscience tailored to student interest. Academic eligibility, you can see that you have to have a bachelor degree in any of the life sciences, including medicine, biology, and pharmacy. English proficiency is a must, and selection process. Selection includes application submission by January. So I'm giving you this timeline based on like it's like an approximation. So the date can be like 15th of January or 30th of January or even in February, but it varies year by year. So if you when once you decide that you want to apply for one program, you have to focus on that, and you have to know the timeline very well. So the application requirement is academic transcript, motivational letter, CV, and references. So apart from this infectious disease and One Health, I didn't see much entrance test in the programs that I explored for you. So you can see this photograph. I took this after one of the deadly fire breakout in the Kutupalong Rohingya camp. So this is the European Master in Public Health in Disaster. So it has even our University of Dhaka is the associated partner in this program. So University the Oviedo in Spain, Karolinska Institute, a very prestigious institute in Sweden, University of Nicosia in Cyprus. So there's a 2-year curriculum. The first year covers the core public health and disaster management module, while the second year focuses on advanced topic research and mobility. So specialization includes disaster medicine, health needs and response, epidemiology, and complemented by a practical internship experience. So academic eligibility requirements. I'm not going through the first three things because these are the same for because my filter for search criteria for you were bachelor degree. You have bachelor degree in medicine, public health, nursing, or other life science. English language proficiency is same for most of the programs. It's 6.5 is the bare minimum in IELTS, and TOEFL it's a 79 plus. Scholarship is offered, and the application opens in November and deadline in February or March. So unlike other like other online application includes academic transcript, CV, motivation letter, and at least two references from your professional or academic referees. Evaluation is based on your academic background, professional experience, motivation, and alignment with program goals. Morphophen is a human diseases models the morphological phenotyping. It's done mostly on mouse. So it has a few universities across Europe in Spain, Italy, Greece, and Portugal. This is a very unique program because this is a 1-year program. The other programs you have seen, most of them are 2 years. This is only the 1-year program. So 1-year program spans 2 semesters covering anatomy, physiology, imaging, deep learning for morphological phenotyping, and experimental design topics. Specialization and final internship. Students specialize in mouse model phenotyping, translational research, and they finish with a practical internship and dissertation. So some of you from who affiliated with CMC Research Club have had this session with Dr. Manfur Rahman Opu, who's a molecular biology scientist, molecular medicine scientist. He also did some work on translational research. So if you want to go to uh, pure research type thing, this can be your option because it's like very advanced and very I would say uh, it's very evolving in terms of your career, and also in terms of you will be able to contribute to the medical science from the very core. So this selection process includes this application deadline in March and with academic and motivational assessment like other programs. Here you can see that English proficiency is a bit higher. So it's IELTS score of 7 is a minimum and TOEFL score of 90 or higher is mandatory. So this is one of my favorite subject, environmental contamination, toxicology, and One Health. So while I was telling Varun and Kaushik before we started the session, while doing this study for this presentation, I was thinking that why I didn't apply for these programs like this one, environmental contamination and toxicology and One Health, or public health in disaster, or there is one I'm going to describe you next. So this is mostly these partner 6 European universities across Spain, Norway, Portugal, France, and Belgium. Year one covers the fundamentals of pollution, biogeochemistry, toxicology, ecology, and risk assessment. Year two curriculum, it focuses on health risk assessment, research project, internship, and the specialization options, which include ecotoxicology, then toxicology and environmental chemistry to deepen your expertise. So this is very similar to other programs, and it might include an interview. So anytime the consortium is up, is their decision. They can organize interview when if they think that an interview is necessary for selection process. The next one is live. It's called Leading International Vaccinology Education. So one of the alumni of this program, I know he's a graduate from Sylhet MAG Osmani Medical College, Dr. Sultan Mahmoud Sami. He completed this. Now he's doing his PhD in University of Perth. He also worked for WHO during the COVID-19 pandemic. So the partner universities are here in Spain, Belgium, and France. So there are year one cover topics like immunology and health policy. Year two focuses on advanced vaccinology and internship. Program specialization, you can specialize in vaccine research, in industry application or communication to tailor your expertise. The selection process, I'm not going to much detail, because if you think that you will apply for this, you have to have a very clear idea about the eligibility, language, proficiency requirement, how much a scholarship is available, what do you need to submit for application, and when is the deadline. So this is one program I applied, and I was not successful in the application phase. This is European Master in Health Economics and Management. So from my student life, I was involved in leadership activities in different voluntary institutions, and then in different professional roles. So I like this subject of health economics and management. So there are 4 European universities: University of Bologna, then Erasmus University Rotterdam, Oslo University, and MCI, the Entrepreneurial School in Austria. So year one curriculum includes health economics, management, and leadership and policy. Year two offers you 4 specialization track and a master's thesis focusing on advanced healthcare management topics. So eligibility, I'm not going to too much detail, and it has academic review, your motivational assessment, and possibly an interview. Human response is the coordinated humanitarian response, health and displacement. So the number of displaced population across different countries are increasing due to different international and intranational conflicts. So it has a collaborative partner institutions from universities in Europe and Africa working together. I can tell you the name of these universities. So there is University of Athens, University Institute of Lisbon, Norwegian University of Science and Technology, then Makerere University in Uganda, University of Cape Verde, then University of Santiago, also in Cape Verde, and Rovuma University in Mozambique. So most of the universities were selected in Africa because there are lots of humanitarian crisis over there in these countries, and you can work, you can learn, and at the same time you can contribute to helping those people. It has advanced modules, then field work, internships, summer school, and all this in Africa. So let's go to the next slide. So this one was one of the subject that when while preparing these slides, I thought that why didn't I apply for this? This is a physiology and medicine of humans in a space and extreme environments. So the partner institutes are in France, Germany, and Slovenia to provide interdisciplinary education. The two-year program includes 4 semesters across 3 different countries covering biomedical and environmental physiology plus thesis work. The focus areas include space medicine, extreme environment physiology, aerospace life support system to meet space exploration needs. So eligibility criteria, you must have hold a bachelor degree in relevant fields such as life sciences or engineering to qualify. So English proficiency is at B2 level is mandatory. Scholarship is there, and their academic review, motivational assessment, and possible interview. So the name of this program is very beautiful. It's called Emotion, European Master of Science in Skin Care, Health and Care. So the program is offered by 3 universities in Italy, Spain, and Belgium. It's called Università del Piemonte Oriental in Italy, Miguel Hernandez University in Spain, and University de Namur in Belgium. It's a 2-year program. Year 1 in Italy is focused on skin physiology and testing. Year 2 is in Spain or Belgium for specialization and internship. So either you can specialize on research and development for cosmetics, dermatological drugs, or medical devices during the second year. So the eligibility is languages at B2 level, and like other, it's similar to other programs. It has a deadline. There are academic and motivational assessment, and possibly it can include an interview. So I would like to share some experience from my life. The thing is that you have to have hold a bachelor degree in health or science with at least 180 CTS, and documentation preparation. The CV needs to be in Europass format. That is a common format for all academic and professional CVs in Europe. If you Google Europass, it will be there. Motivation letter should be linked to your goals to a specialization. And my experience is if you answer a few questions in the motivational letter, that will give the assessor a clear idea. First one is, who are you? In a nutshell, like very briefly. Why why do you think the first thing is that was the situation of that specific thing in Bangladesh? For me, I wrote about the environmental and occupational health scenario in Bangladesh. Environmental health scenario in Bangladesh is quite non-existent, and in the industries, lots of people die every year. Many people dies due to industrial accidents. People who are doing internship in the Chittagong Medical College Hospital, now you have a dedicated burn ward. When we did internship, there were no burn wards. So I can remember one day we were in an admission duty in Ward 27, the surgery ward. So a group of people, they ran into the ward. They were crying, they were shouting because they got burned due to an explosion in the shipbreaking industry in Fozdarhat. Um, we didn't have much in our hand to support them. So we had to prepare the critical patients for a long journey to Dhaka. So if there were control systems in place in those industries, these accidents there were very low chance of happening. So it's a not quite non-existent in Bangladesh. You can work in the policy level. There's one occupational health and safety policy, but it's up to that policy that it is not translated into any legislation or regulation. So I briefly described what's the situation back in Bangladesh, and what can I contribute when I complete this. So I briefly mentioned that after completing this, how I can contribute in terms of occupational and environmental health, which I did in my tenures with WHO in Cox's Bazar. We worked with close interface with the government and helped to improve the environmental and occupational health scenario for the healthcare workers in Cox's Bazar. Um, so these are the things you have to think about when you are writing your motivation letter. Assessment and interview strategy. The assessment values your academic excellence, your experience, and adaptability. So many of our participants are undergrad medical students. So it might sound a bit disheartening for you, but uh, unless you have a few years of experience in the respective field, I think you have higher chance of facing rejection in these applications because your experience matters. And when you apply for these, they want to see that whether you have spent some time in this specific subject matter so that you can build on that, getting advanced education and experience. And when you go back, you can contribute on that. That is my experience. So if there is interviews, it should highlight your resilience and training from setbacks. So if you go through competency-based interviews. You can note it down. It's called competency-based interviews. It's a strategy that's taken in lots of UN agencies when you apply for any job position, and also these scholarships. That do you have the necessary competencies for is, and if you have, then in the interview they ask you that when I applied for one job, they asked me whether I have any experience in conflict resolution, whether I experienced uh, any rebellion in my team, any of such experiences, and how did I manage? That was my first job experience with South Australian Northern Territory Oil Search back in 2011. Um, these things can be this can be another 1 year, 1 hour or 2 hour session on these stuffs, but let's not go to that much detail. So application timeline is very important. So you have to go through application opens in October and closes in January with the results announced in April or May, emphasizing the deadline adherence for any of these applications. So your roadmap to success. First is early preparation. You should research the program, which program you want to apply, which program meets your motivation and aspiration and your previous experience. And then you can see, do you meet the eligibility criteria? So our undergrad friends, you can look for this from now if you want to build up your career in any of this specialization, so that you can gather relevant experience through your journey, and then you can show it in your portfolio. So I'm in my late 30s, if I tell you my age. So I'm already, when I started applying for scholarships back in 2012 or 13, I got selected for Karolinska Institute for Masters in Public Health. But I told you about the deadlines. See, that's from my own experience. So for Swedish Institute scholarship, there are specific application window for the scholarship, like 15 days or 3 weeks. So if you don't apply in that window, they won't consider you for the scholarship. So somehow I missed that deadline. So in June or July, the Karolinska Institute sent me a mail that congratulations, you got selected for this prestigious masters at Karolinska Institute. And since you didn't apply for any scholarship, uh, in bracket they implied that we think you are rich enough. You will come here and do self-funded study. And that masters called that cost almost 40 lakhs taka. I didn't have that much money, first thing. And the second thing is that I won't spend that much money without a scholarship, because I know that I'm eligible for a scholarship. So that's my own experience. Never miss the deadlines. So you should study this, that when is the deadline, what do you need to achieve in your coming years to be a valuable and competitive applicant for this. Leverage your national strength. You highlight your national achievement and unique experience to enhance your scholarship application. When I applied for Europe of Health, I had 5 to 6 years of experience in environmental and occupational health. And I knew that I was telling to this friend of mine, Dr. Sami, who briefed me about this Europe of Health program, that if there's one person who will get selected for this specific track, Sheffield Paris track, and a specialization in environmental and occupational health, that would be me, because the experience I have, that is unmatched. So I don't want. I would like to emphasize that the competition is increasing every year. So you have to think about building your career in subjects which is unique. Um, there are lots of people who are doing medicine, surgery, gynecology. With full respect, with due respect to them, if you want to build up a career which is very unique, then you might face some hardship in the beginning, but at the end you will be rewarded. So I can share one experience. In the beginning of this year, I just got the membership for the Society of Occupational Medicine here, and I was looking for jobs in NHS or in the industries, and I started my postgraduate diploma in occupational medicine. So when I reached out to the local the occupational health, occupational medicine consultant in this West Midland region of England, so one of them told me that I don't have time to reply to your email. I work in this hospital on Wednesday and Thursday. Can you please come and see me? So I went there the next Wednesday. That was his last day at that organization. So he introduced me to the deputy manager. And they told me that they were looking for a consultant for occupational medicine for last 4 years, and they couldn't find any. Because the occupational medicine scenario is that if you are a consultant, you can earn more money without working in NHS, working in the industry. So if you open your own company, you do consultation and you earn money. That's how it works. So when they offered me instantly like a permanent contract, which is a very rare for any clinical specialties these days in the UK, provided the job situation in the NHS. So, and if you are the last one is from my experience, if you are confident enough, that yeah, you have high chances of getting selected, you start learning maybe French or Spanish, wherever you want to go for your like a rotational year. That will help you a lot. And if you have a certain level of qualification, that will help you in if you want to secure a job, maybe in France or Spain or Italy, that language will give you much advantage. So this thing, I think, been covered by Varun's presentation. So these career pathways from clinical or academic role create pathways to leadership in European and global health policy. So multicultural learning environment, it's very diverse. So we had friends from every part of the world, and still we are a very good community. Still we chat in WhatsApp. We meet once a year with a video call. And whenever I'm visiting any place, like if I go to Philippines, I know that the two of my Filipino friend is there. One of them is a big boss in their health ministry. He's a program. He's I think one of the they call bureau chief for one of the health protection agencies. So I know that I have my friends all over the world. Wherever I go, I have my network. So one thing you have to remember that your network is your net worth. So please build your network cautiously in that way. And overcoming challenges during this journey helps you to cultivate your mental resilience and renewed purpose. So one experience I can share with you during the pandemic when I was moving from Paris to Geneva, the I sent two big baggage full of my all my stuff. It had my some of my valuable stuff, my watch, my like a suit and stuff, and the courier service lost them. So I reached Geneva and I had only my cabin baggage with me. It had two pair of formal clothes and some t-shirt and trousers. So I ended up with this. And then I had this Erasmus, this scholarship comes with the insurance package. So I was reimbursed with all the thing I lost and stuff, and that was a huge support. So this way, this journey helps you to build your resilience. Uh, you can imagine yourself in a different town rather than your hometown or home country. You don't know anyone there. You are building up your network in that town or that city with people from all over the world. You are doing some global collaboration, and you have chances to do leadership activities in all these institutions. I did in University of Sheffield, then EHSP, French School of Public Health. I was one of the face of our cohort during that time. So that gave me lots of leadership experience. So I jotted down some key resources, the resource from where I got all these informations. So I can share this in the chat box so that you can copy this and look for further further knowledge. The Erasmus Plus EMGMD catalog is there. I tried to be cautious when I was searching out these programs, but if I miss something, you can go to the catalog and find it out by yourself. Final note. Thank you for this opportunity and thank you giving me this chance to talk to you. It always feels very good um, to return some of the experiences that return to the people from they are connected to my alma mater. Any of the places, either it can be Chittagong Medical College or my school, my college, all of them in Chittagong. I'm born and brought up in Chittagong, the coastal town, and also later I studied in University of Sheffield, then Paris, EHSP Paris, and then also we had a a very good cohort of WHO headquarter interns. We are also connected till now. So you can reach out to me in my email, also in my LinkedIn, and I would like to request you to provide me some feedback through this feedback link. That I will provide that in the chat box shortly. And if you have any questions, you can ask me. And I already tried to answer some of the questions that Akib and the CMC Research Club team gathered previously. Thank you very much.
Thank you, Bhaiya, for the presentation. We have some questions in the chat box. I guess I can read out for you, and you can address them one by one. Uh, yeah, I guess you are muted. I can't hear you.
Okay, let me share these links that I promised to share in the chat box. Then I will answer all these questions. Just a minute. And I have one feedback link to share with you. So you can provide your feedback in this form at your convenience, not now. So Kaushik, please shoot your questions. Problem.
Okay, yeah. Um, Someone asked that they have completed their MPH on maternal and childhood health recently, and she is 40 years of old with a child of she has two childs now. Like, do you think it's gonna be worth it to apply for the Erasmus program at this age with this situation?
Well, when I applied for this, I was 33 years old. Hi Moshumi. I'm reading your question now and answering this. So you already have a master's. You already have an age, but the thing that I would like to point out is maternal and child health is a very good track for low and middle income countries. So unless you do a specialization like in other stream, if you want to like what is your target, it depends on that. Age is not a matter as the famous saying, age is just a number. So you're mother of two adolescent daughter, you can apply for this. And when we if you are selected for this, in UK there is a problem because recently they are not allowing dependents on masters programs. But for other programs, I think it should not be a problem. You should search through the catalog and sorry, I talked for so long and now I'm having some issues with my voice. Yeah, so yes, you can apply for this, but you have to be careful about that. UK doesn't allow dependents for the masters in your visa. The dependents won't get visa for the masters programs unless it's a research masters. The masters in Europe of Health, uh, they don't give visa to the dependents anymore. So you have to be very cautious about it. What's the next question?
Thank you, Pierre. There's another question like, does Erasmus Mundus cover all the programs and does it also cover the Europe of Health program?
Oh,
It's
Europe of
provide.
Health is one of the Erasmus one of the programs that is covered by Erasmus Mundus Excellence Scholarship. The programs that I showed you, most of them, like all of them, are covered by Erasmus Mundus Excellence Scholarship, and it covers your travel expense from your home country to the country, and after 2 years, your travel back home. This thing covered, and then your living expenses when I was doing my master's. We used to get 1,000 euros per month. Now it's, I think, for 1,400 euros maybe. Is Varun still here? He can correct me if I'm wrong, because I don't know the current stipend scenario. And also the this Your health insurance is there, your education tuition fees are covered, so it's a very comprehensive package. And even I told you, like, if you lose your baggage, even that is covered by the insurance. If your airline loses your baggage, you'll get paid, not for the whole money, but up to 3,000 euros, I think.
Yeah, Erasmus is a very lucrative scholarship. Um, there's another question. Do you think it's possible for someone who just graduated to get a scholarship even without work experience?
That's a tricky question. Because as I told you that when you write your motivation, okay, he or she wrote something. The only experience I have is working with the Riverside communities at college because I live in Amazon. Well, you have a high chance of securing the scholarship, I must say, because you are working in Amazon. That is already an
Yeah.
extreme area where you are yourself doing like preventive healthcare. It's amazing. You should definitely apply. I'm actually I'm reading this four line. I'm really impressed. And now when you write the motivation letter in the right manner, I'm sure that they will be impressed too. The consortium, the who assess this. So
Okay.
somebody, yep. What's the
There's
next
an
question?
there's another question. Like, if someone has 60% marks in prof exams, are they eligible to apply for the scholarship?
So I should answer this in a sarcastic way. Do you think that I failed this exam, didn't secure 60% mark, and applied for this? I passed this exam and I applied for this, right? So, but I'm not sure about the WES evaluation because when I applied, WES was not mandatory. I submitted the transcript we received from the university. I submitted that. That was enough. And I'm not sure about the WS evaluation, but in most of the cases, I think it's mostly for Karolinska, the Swedish Institute scholarship. You might need that for application to US universities. You might need that. Even in UK, they like
No.
I'm not sure about that scenario.
As far as I know, WS evaluation is not required for the Europe
Yeah,
programs.
Europe doesn't bother about WES. They see that what did you do? Did you have a good result? 60% is always a good result. Our when we pass, we have a good result. That's for sure. And then your experience. What did you do throughout your career? And also, what's your motivation? Does that match with the track you're applying? So the other thing I wanted to share, I started photography in 2013, I think. So when I applied for this scholarship, in my back of mind, one of the things is that I will live in Paris for a year. I will try to capture the moment in the Paris, the beautiful city, the city of light. So that was one of my motivation. I wrote it in the motivation letter that one of the main reason I want to apply for this Sheffield Paris pathway is I want to live in Paris for a year. I want to see the beautiful city and also the beautiful country of France. Um, Even if this environmental and occupational health track was not in Paris, that would I would lose some of my interest in applying to this. So yeah.
One question is from like someone tried to contact the European Public Health Association
Okay.
in
No.
Instagram,
Yes.
like
Yeah.
with some alumni, but they didn't reply. So they're asking
Uh,
what's the best way to approach them, getting the
you
feedback.
write to the consortium directly, but if you want to ask for something related to your application, you apply to the you apply to the consortium directly. Like you contact the consortium directly. EFSA is the like a voluntary organization. So if the one who's in charge of the social media handle, if he or she has exam, they won't see the messages, right? They will take some time to come back. So you have to bear with that. But you can always reach out this. Europe of Health Consortium. They're the official body to answer your question, and you can find most of the of your answers in their FAQ section. So so one says that application process. Well, I'm sorry, you have to do your application by yourself. That's the hard truth because this the webinar by EFSA that will be very helpful for you. So
Yeah.
you look for all the aspects of your application process. If you feel that some places you are not you are finding difficulties, then you write down to EFSA, attend their webinar and ask the question. They will answer it. All right. Um, Publication.
Yeah,
So prior to
publication.
applying for this scholarship, I have zero publication. Zero publication. To be honest, I'm not an academician. I'm not an academic researcher. I'm an environmental and occupational health or occupational medicine professional. So I work for oil and gas industry, then pharmaceutical industry, and then I was working in radiology. In those industries, there's this specific confident like a clause for confidentiality. I cannot yes, I analyzed lots of their data for my work, but those were not allowed to present anywhere. And or there are ways you can publish it, but it's so much bureaucratic and so much complicated. I didn't choose to, so I have zero publication
Okay.
when I applied for this program. Now I have some publication, but none of them are as a lead or first author. So I'm not a researcher.
One BDS intern is asking how it's a good way to create their profile and what kind of things they need to do to get the to secure the scholarship.
First thing is that engage into volunteering activities, whether it can be in your medical college, it can be uh, in your locality. Try to do something that helps the people and that helps you in return. So you will have, if you have a leadership experience or volunteering experience, that will make your application stand out. So the other thing is that uh, your motivation matches with your experience and also your aspiration. Aspiration means the track you are applying for, the subject you are applying for. For example, I got rejected for health economics management. I had experience in health management, but not in health economics. So maybe I was not, I could not um, submit the application or the motivation letter in a convincing way that I'm interested in health economics or I have enough experience in the health economics arena. You understand that? So there are three things. One is that who you are, what you did, what do you want to do, and was this the situation of that specific topic in your country, and after doing this specialization or masters, how you can contribute to your community. To answer this, you'll find a very good motivation letter. And these days, you can use the AI. Don't use AI to write a motivational letter. You draft the motivational letter, then you can proof check it. You can use it to proof check it or in some other way, but don't ever use it for your like drafting your motivation letter, because all the institutions, they now use like a AI detector. They detects it, or if someone is a very experienced person, if he reads that, he can understand that this is a AI generated. All right, Akib. Yes, it will give you priority, because neuroscience and translational research, you can have some clinical experience in neuromedicine or neuroscience, but apart from that, in in Bangladesh, you don't have much opportunities in translational research, right? So whatever research you do in neurology, that will give you edge.
Yeah, some people are asking questions about like, like, is it good to go for the Erasmus as a fresh graduate? Do you have any
Uh,
advice for the fresh graduates?
my advice is, as a fresh graduate, I think you won't be able to crack it unless you are someone very extraordinary. So in my cohort, I haven't seen anyone who was a fresh graduate and got the scholarship. So most of the people I was there, the the one who came like very young, maybe just out of the graduate school, they were self-funded mostly. So my experience is that they value your experience on the relevant field. So uh, I can accommodate 5 more minutes, then I have to leave. All right. Any other questions?
I think all the questions have been answered in the chat
Okay.
box. If I missed any one of your questions, uh, could you please put it again in the chat box? Or even you can unmute yourself and ask the question directly.
If any question is unanswered, you can put it in the chat box again. I think I covered already this. First thing is that leadership and volunteering activities. The second thing is that relevant professional or research experience. And the other thing is that how you can sell yourself. It's like making your portfolio. This scholarship, they provide like almost 46,000 euro scholarship. Now it might be more without talking to you. So your motivation letter will speak for you. You have to have a very good motivational letter for that. And always like you draft your motivational letter or SOP, you get it reviewed by your peers or people who already went through the path if you are connected to them. So I can remember that I think I'm the first Bangladeshi doctor who got selected for this uh, European Master in Public Health APH program. After me, there was Dr. Bari Hassan Shubho. He works for NICE now, National Institute of Clinical Excellence in UK. Then we have Dr. Morshed. He is now in Ireland. He is working for the government with the public health interface. And who else? Yeah, not much people. So if you stand out, you will definitely have advantage. So if you don't have any other question, I would like to request you to provide me feedback. So just to tell you that this presentation, I'm in a portfolio pathway for a specialist, uh, like a specialist pathway for occupational medicine. Like with my regular ongoing work, I will apply for that, and I will mention about this session that I did this session. So your feedback means a lot. Once I get your feedback, I will put it there. It will be helpful for me. Thank you very much. So let's end this session with high note, and I hope many of our young graduate they will pursue this path and go to different European cities, and I hope you will find some benefit from this session.
Definitely.
Thank you so much.
Thank you so much, Bharat, for joining, and also thank
Okay, take
everyone for
care.
joining the session.
Yeah. Bye.